And then I'm going to look for the point of maximal impulse. It is at the left midclavicular 5th intercostal space. So, let's see. I can't see it moving, but I can feel it. All right, we are going to move on to palpation. So are you having any pain in your chest or back?
No.
Okay, so I'm just gonna feel. I'm feeling for any heaves, lifts, thrills. And I'll feel the back. If you will look to your, or move your body to your right. All right, and then I'm going to check for chest expansion. So I'm gonna feel near the bottom of the 10th rib. And then I will have you take a big breath in and out. All right, I'll have you do that again. In, out. So I'm checking for symmetry bilaterally, which she has. And now I'm going to palpate for tactile fremitus. So I'll start on the back. I'm gonna, each time I move my hands, just say 99. All right.
99, 99, 99, 99, 99, 99.
And it sounds the same throughout. Then we are going to palpate the carotid pulse. So, and it is 2+ bilaterally. And then I'm going to feel again for the point of maximal impulse down here, left midclavicular around the 5th intercostal space. Okay. We are going to move on to percussion. I'm gonna percuss both sides of the chest. So I'll have you look this way. So, okay, and then I'll do the front. Okay, and then I'm going to go back to the back and I'm going to percuss above and below the diaphragm. Okay, now we will move on to auscultations. First, I'll listen to breath sounds. So every time I move my stethoscope, if you will take a big breath and through your mouth. Okay, I'm gonna list, if you'll lift this arm up. Okay, do the other side. All right, if you will turn your body that way, I'll listen to the back. Okay, I did not hear any adventitious breath sounds, crackles, rails, wheezes, stridor. Now I'm going to listen to the heart sounds. So the first one I'll be listening to is the aortic valve. It is right sternal border, second intercostal space. And you don't have to breathe. Well, yeah. I mean, you do have to breathe, you know. Then I'll be listening to pulmonic, left sternal border, second intercostal space. I'm listening to Erb's point, left sternal border, third intercostal space. Now I'm listening to the tricuspid valve, left sternal border, third intercostal space. And now I'll be moving on to the mitral valve, left midclavicular, fifth intercostal space. Okay, now I'm going to listen to the carotid for carotid bruits. So I'll listen on both sides. Just hold your breath for this first one. I'm going to listen with the bell. Okay, we can breathe. And then hold your breath again. I don't hear any bruits. I'm going to go back with the bell and listen to the heart sounds again, listening for any murmurs. And then I'll have you lay kind of on your left side, and I'm going to listen to that same point of maximal impulse to see if I can hear a murmur better on the left side. Don't hear any murmurs. Okay, so now I'm going to I'm going to do the bronchophony, egophony, and whispered pectoriliquy. So for the bronchophony, I'm going to have you do the 99 again, except I'm not going to use my hands, I'm going to use a stethoscope. So if you want to face that way, and normal findings, it should sound muffled throughout is what we want to hear. All right.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, and for the egophony, I'm gonna have you say E each time instead of 99, and it should sound like an E on my end. If it sounds like an A, there could be some fluid or something in there. All right.
E,
E, E, E, E, E, E, E, E, E. All right, and then last, I'm gonna have you whisper 99 each time. Okay. So next, we've done all that. So now we're gonna go on to peripheral vascular. What time are we at?
12 minutes.
Oh Lord. Okay, so I'm gonna look at the hands. I'm looking at the size, symmetry, swelling. I would do cap refill. I'm just gonna squeeze and look for the blanching, less than 3 seconds. I'm going to feel her radial pulses. They are 2+ bilaterally. I'm going to feel the brachial. They are also 2+ bilaterally. And the epitrochlear nodes, I'm gonna have you do like 90 degrees. I can't feel them. Okay, so now we are going to do the legs. So I'm just gonna do like a 360 view of your legs. I will have you stand in a minute. So I'm looking at the size, swelling, the symmetry. I'm looking for any varicose veins. You can stand up real quick. I'm just gonna pull these up a little and see if I see any varicose veins, which I do not. I'm going to feel the temperature. It's warm, equal on both sides, as well as your arms. All right, you can sit back down. I'm going to feel for the inguinal nodes, so right in here. Okay, and then I'm going to feel for the popliteal pulse. So let's try to do it like this, maybe. Not gonna lie, I can't feel that. We are going to feel the posterior tibial pulse. Okay, now we're gonna feel the dorsalis pedis pulse. If you can remove your shoes, please. So those feel about 1+ bilaterally. Checking for cap refill. Okay, and then we will check for arterial insufficiency. If you want to lay back and I'll help you hold your legs up. We'll wait till the color kind of drains from your legs, and then we'll put your legs back down and see how long it takes to come back up. And we're also looking for any edema. I don't see any. All right, now you can put your legs back down. See how long the color takes to come back. See, they're turning pink again. All right, I believe that is everything.
I think I'm good. I'm gonna have you stand up. We're gonna inspect your chest, okay? So I would be looking for any abnormalities such as, let's say, a barrel chest or any lesions that shouldn't be here. She's not barrel chested or anything, and as for lesions, you know, we've got those normal freckles, normal freckles that everybody has. I mean, they're round, they're pinpoint, and they're not raised on the skin. So I wouldn't be worried about any abnormalities here. Next, I'm going to go ahead and listen to your lung sounds, okay? So just go ahead and take deep breaths, and I'll follow with the stethoscope, okay?
Okay.
All right. All right, if you want to lift up for me.
Mm-hmm.
Sorry.
Okay.
Okay, I'm going to move mid-axillary here. Okay. So I didn't hear any crackles or wheezing or anything abnormal that I should be worried about. Everything sounded fine. If you want to turn around, we'll do it again on your back. All right, same thing as before.
Okay.
All right, I'm going to go under here.
Mm-hmm.
All right, and once again, I'm going to mid-end right here, mid-axillary. Okay. So same thing here. No crackles, no wheezing, everything sounded fine. Next, I'm going to move on to heart sounds, okay? So I'm going to start at the aortic, which is second intercostal, about right there, on the sternal border on the right side. I'm going to move to pulmonic, second intercostal, sternal border on the left side. I'm going to move down to Erb's point, which is third intercostal on the left side. And I'm going to move down to the fourth, which is the tricuspid, and on the fourth intercostal left side, sternal border. Okay, and if you can adjust up, we'll go to the mitral, which is fifth intercostal, midclavicular. Okay. So all the locations sounded good. I didn't really hear any S3 or S4 sounds. I did hear S2 loudest at the top, and the S1 was loudest at the bottom, which is also perfectly normal. So I wouldn't have any concerns. Next, I'm going to move on to your abdomen. If you want to lay down, I'll move this out of the way. All right. And so if I was in a hospital setting, her bottom half would be covered as well as the top half of her abdomen. Looking at it, the color looks even. I don't really see any darkness in specific areas. It looks even, and it looks to be symmetric also. So are you having any pain in your abdomen?
Nope.
Okay, so I'm going to actually auscultate first. I'm going to start in the right lower quadrant. I always mix those up. All right. So just breathe that normally. Okay, so I would say I heard about 12 abdominal sounds, which is normal. You don't happen, you said you don't have any pain?
Nope.
Okay, so if she had pain, I would palpate the next quadrant in the clockwise formation of it and end in the quadrant with pain. But since she doesn't, I'm once again going to start in the lower right quadrant. All right. Let me know if there's any pain. All right. Anything up here?
Nope.
Here?
Nope.
Okay. Any here?
Nope.
There? Here?
Nope.
All right. And here?
Nope.
All right. So I didn't feel anything, nothing protruding or anything. It feels normal. I don't know how else to describe it. There weren't any abnormalities, nothing sticking out. It was even, so I'd say we're all good. All right, if you want to sit up.
Mm-hmm.